like these that really do remind us of the profound impact that we can have when we come together in action. During our visit, we engaged with leaders of our longtime partners in Kenya. We witnessed tangible results of our efforts: healthier communities, stronger health systems, brighter futures. HHS and its operating divisions, all of our family of HHS, appreciate our long-standing partnership. U.S. government agencies are committed at the highest working together to protect the health and well-being of both Americans and Kenyans. Our shared missions offer countless opportunities for confident that by joining forces we will continue to achieve great things. As we celebrate our 60th anniversary of the relationship between the United States government and the government of Kenya, we reflect on our joint achievements in health, from controlling infectious disease, improving maternal and child health, and preventing non-communicable diseases. Our cooperation has made significant strides. We also celebrate our successes with initiatives like the United States President's Emergency Plan for AIDS Relief, we lovingly call PEPFAR, the President's and our efforts to continue to advance health systems in Kenya. Today, we commit $31.1 million for the Kenyan health system with digital data through support for facility and community information systems. And if the minister has her way, she'll take all of our data scientists home with her to power million. Additionally, the U.S. government has provided professional development to hundreds of thousands of Kenyans. Moments ago, we launched a health-focused emergency management training program during our tour of the Emergency Operations Center that will build the capacity of public health across Kenya. Finally, we are pleased to announce a twinning relationship between the Kenyan National Public Health Institute and the UNC, our nation's public health institute. At HHS, we recognize the critical role of global health diplomacy in security, improving health outcomes, and advancing sustainable development goals. I'm excited about the possibilities that lie ahead, opportunities to deepen collaboration, leverage our respective strengths, and achieve even greater impact. During this visit, we look forward to a renewed partnership with Disease Control and Prevention and the Kenyan Medical Research Institute, or KEMRI, and to setting the framework for our future collaboration through PEPFAR that supports Kenya's vision for the health of its citizens. Thank you all for welcoming us here and for our distinguished guests joining us today.
Thank you, Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, my friend, Deputy Secretary for Health, Director CDC Cohen, Prime Cabinet Secretary, senior government officials from both Kenya and the United States of America. Today is a profound day for us to be here, meeting here to discuss and celebrate our collaboration, especially the Ministry of Health with CDC and the United States of America. Your Excellency, could not have come at a better time than now. As we sit here, the world is now converging to discuss national health regulations, to discuss the pandemic treaty. And all this is to build consensus for members around the globe to be able to prevent, to detect, and to respond to public health emergencies. We have here, Your Excellency, at the Emergency Operations Center. So, Your Excellency, as a country, we have taken the steps of the CDC, and we are now establishing our National Public Health Institute, and it's just to ensure that we are able then to be together with the world as they prevent, they detect, and respond. Your Excellency, infectious diseases do not know geographical boundaries. It doesn't matter if you're in Kenya or you're in America. COVID taught us the lessons. So it is for us as Kenya, CDC, and the United States of America people to work together to ensure that in future, should we have future threats, then together we are able to surmount that. CDC, I want to say thank you on behalf of the Ministry of Health for the collaboration with Kenya Medical Research Institute that is represented here to Songok. You have worked very well with us to build our capacity through the FELTED program. You have worked very well with us to build our capacity, and we are forever grateful. How do I see the next steps, Your Excellency? We now have a baby, the National Public Health Institute. Our success will be measured on how we collaborate and ensure the National Public Health Institute is able to respond to emergencies as they occur. Your Excellency, I have had the opportunity to say to the Deputy Secretary, she did visit our ministry together with Cohen, the Director of a long chat on our plan for universal health coverage. And we did agree that now they are going to plan and build into our priorities. I'm so happy that finally the programmatic areas that we've been having, the vertical responses on HIV, on malaria, reproductive and maternal health, today we are going to find a future where we work together to ensure that we protect our people. Thank you very much.
Thank you so much, Health Minister. So to set the stage for the next part of our discussion, we're going to be going from the large picture of the U.S. government investment, which is about $600 million a year investment, to what is needed for a sustainable Kenya-led health programming. We want to make sure that we're focused on transferring sustainable health programs to the government of Kenya for country-led implementation and ownership. And one country-led programming is creating opportunities for local manufacturing of health commodities. So now I want to welcome Dr. Atul Gawande, administrator, who's going to discuss the topic of regional manufacturing.
Your Excellency, colleagues, two things that COVID taught us were about the importance for sustainability of regional manufacturing of medical capacity available at the ready when crisis hits, and the importance of strong primary healthcare systems that connect, that deliver on that capacity. Today we're reflecting on the success of our joint partnerships in both of those domains to try to the celebration of the remarkable leadership, President Ruto, you have made in both these domains. I've seen you speak from incredible knowledge about these areas. First of all, to comment a little bit about how you're leading the way on primary health care. You have a set of 4 laws that have dramatically changed the landscape. First of all, by committing to more than 100,000 paid community health workers, an extraordinary standard. It's raised the bar for the entire continent. And you are not only making sure you are making sure that they are part of a digital health information system where the electronic records are in their hands. And then furthermore, that they are part of primary care networks that link them to every other health system. They become the outreach to the community and the eyes and ears of the entire system. And that is a process that we are all across the U.S. government of being part of. When I visited Kenya last November, out of 315 primary care networks that were established as a goal, there were 20 26 with support from USAID, CDC, and the Department of Defense. I'm proud to say that now 151 primary projects have been accomplished, two-thirds of which are with the support of USAID, CDC, and the Department of Defense. Now, our teams are working together to build that capacity. Can't do anything if they don't have supplies and goods that are needed. And you are also leading the future of what our partnership can be with countries across the world for building capacity. Revital Healthcare is a prime example of what that future looks like. It is a Kenyan company based just outside of Mombasa with a USAID grant of $2.2 million and another $2.2 million in matched funds from Revital itself. The company built the largest medical diagnostic manufacturing plant in Africa. Capable of producing 240 million test kits per year. Further, Revital has developed its diagnostic tests for HIV, malaria, hepatitis B, hepatitis C, dengue, syphilis, and pregnancy produced on-site in It's places like Revital that have given the U.S. PEPFAR program to set a goal to purchase a total of 15 million African-made tests in 2025 and an estimated cost of $20 million from African manufacturers. And so with that kind of commitment to significantly expand purchasing by these programs, USAID is working with the WHO, the US FDA, the Global Fund, African manufacturers, and regional accreditation and regulatory bodies that manufacturers like Revital can manufacture global quality approved tests for serving the needs of Kenya, Africa, and the U.S. President's malaria initiative is likewise actively investing to increase the number of malaria commodities like tests and treatments made on the continent. Africa is home to 94% of the world's malaria cases, but the majority of malaria cases are imported from elsewhere. And so in the last year, PMI, as the program is called, has doubled its purchasing of African supplies for anti-malarial drugs and treatments, for example, from the Kenyan manufacturer Universal Corporation Limited, and from also another Kenyan, Dawa Life Sciences. This also includes work with Revital as it goes through the process to achieve WHO pre-qualification for malaria rapid tests, which will enable them to be candidates for procurement by PMI in the future. These approaches, the commitment, all of the connections that have had to be made are nothing short of transformative. Not only are we building health systems to deliver quality service possible, but we're supporting industries that can equip those systems. Kenya's leadership is setting the pace. As Kenya's economy continues to grow, we're going to see mutually beneficial skills, technology transfers at the foundation of the relationship. And one company that I've mentioned already leading the way in these new future partnerships is Revital Healthcare. I'd like to turn it over to Harsh Mehta from Revital. He's the Director of International Business Development and can talk a little bit about what Revital is doing.
Africa's largest rapid 20 million test kits per month. When we started in the year 2008, it was only 2 million medical devices per month. We're now manufacturing and exporting more than 200 million devices per month. The positive impact is to ensure that our own country and our own continent receives adequate medical supplies. Africa is a continent with high disease burdens in the world. We've got malaria, we've got HIV, we've got hepatitis. These are all three communicable diseases that's killing millions of people within Africa. The main reasons why? Because adequate testing is not done. So establishing this facility with the USAID Kenya team, we're now ensuring that there is always going to kids throughout of the continent. We also want to ensure that our country grows economically.
Through USAID, we have continued to increase the number of jobs here at Revital Healthcare. Currently, with 650 people working at Revital, with 80% of that being female, Revital is introducing 200 new jobs, prioritizing female employment, but also putting an emphasis on speech and hearing impaired individuals.
Revital has really impacted way. This will really push me to expand my career in future. I get to share this knowledge with my family, with my community, and also to educate this awareness, how to use the product.
Good afternoon, everyone. As you already know, my name is Harsh Mehta, Director of International Business Development at Revital Healthcare. I stand here today with the 650 people working at Revital as their representative and the voice of the chairman himself, who's sitting right in front of me. Thank you so much for having us here today, and thank you so much for giving the private sector here in Kenya the opportunity to actually speak and voice our own opinions as well. Being a part of this stage and being a part of the members on this stage itself is something that holds a lot of weight. It's true greatness that I have towards the left of me over here, and as somebody as young as me right now, being able to actually speak is also a big opportunity for us at Revital. Thank you so much for everything that has been done from USAID, PEPFAR, and the work that has been done over the past couple of years that has allowed us to put ourselves on this platform today to make sure that we can make an impact in Africa for Africa. Now, as I move forward with our comments, I feel like that why Revital and why is there so much emphasis on Revital over the past few years with USAID? Revital has been focused on making sure we continue to provide accessible, affordable, and child and life-saving medical devices on the African continent for the first time. And providing support for people, and that has been our core value all the way throughout the past 16 years in operation. Now, during this time, we've managed that we support vulnerable demographics across the rest of the globe and make sure that we provide maternal and child health for Africa for the first time. Now, in addition to that, we've increased our capabilities with the products that we've been manufacturing and the know-how that we have had made us these leaders here today. Now, as we move forward, we've always had an initiative which is to support the Kenyan government with the products that we're at. Now, over the past couple of years, and especially after Your Excellency President Ruto, you have managed to ensure that local opportunity for local procurement and preferential procurement for the first time, especially for us manufacturers here in Kenya. Now, that so much weight and so much confidence on a local manufacturer such as us, because it gives us the confidence to continue to move forward, as well as provide more investment, more jobs, more socioeconomic benefits, and more economic development within the country itself. The technological advancement that goes into medical manufacturing has been seen before, and with the support of USAID, we've managed to ensure that we're now going into the manufacturing of rapid diagnostic test kits for the first time at an end-to-end scale for Africa ultimately. Now, as we have moved forward, our capacities has grown rapidly. We have 1 billion medical devices manufactured annually. We have touched approximately 600 million lives in 2023, which is the impact that a manufacturer can do in Africa for the first time. Now, additionally to that, having all the different certificates has enabled us to export globally to 30 countries across globe. Now, support has always come from partners. Having true key partners is what makes private sector perform at the highest level. Partners such as the government of Kenya, from Your Excellency President Ruto, this has enabled us to give us that confidence to move forward, but also from the likes of the Bill Gates Foundation that helped build the capacity for our 0.5 ml vaccine syringes that ensured that there is capacity for immunization campaigns across the entire of Africa. That enabled us to increase our capacities to 330 million units of the 0.5 ml vaccine. Now, that with USAID coming on board, with the technologies that we're developing, again, this will create even more jobs and even more technologies for Africa for the first time. Now, I want to pledge something which is what Dr. Atul, you have mentioned. Revital promises to have an ERPD and WHO pre-qualified HIV rapid test kit in 2025 to support PEPFAR's initiative for 2025 for local procurement in Africa. Now, even more importantly to that is we're putting a flag, or we're putting Africa on the map, and we're putting Kenya on the map. Technical leader in the manufacturing of medical commodities that are so highly required. We're reducing our over-reliance on the East, and we're reducing our over-reliance on foreign exports, and now finally locally manufacturing, which has strongly been supported by, again, the government of Kenya, as well as our friend here, Professor Songok from KEMRI, to make this a reality here. Now, as I now conclude, this is not what we want to continue doing at Revital. This is not where we stop. We will always try and push the technology and more Africa and develop healthcare security in Africa through centralized warehouses and pharmaceutical repackaging, where Revital now calls upon to try and bring more US-based technologies and more US-based pharmaceutical companies into Africa for the supplies of generic medicine, so that there is a complete stoppage in terms of the gap that is currently available in the market. I'd like to thank you all of everyone here today. It's time, and God bless. Thank you.
I'd like to welcome Prime Cabinet Secretary of Kenya, Musalia Mudavadi, to say a few words on health and innovation.
Your Excellency, the President of the Republic of Kenya, Your Excellencies, Dr. Mandi Cohen, distinguished ladies and gentlemen, I don't know whether I'm qualified to speak in such an institution, but I can only say this, that, and I know I'll be speaking for so many Kenyans here, that it is indeed a humbling moment to be able to come to this world-famous center and to be able to visit what I would call the global situation room that we have just been to, where one can see a global bird's eye view of what is happening in matters of health in all continents. Three things are very critical and at the center of what Kenya tackles. Health is one. The President has been extremely passionate on that, and he'll speak to it. There is education, and the other is ensuring that there is food security. These things don't come, particularly health. It's very expensive. It's a big challenge. And as we reflect on the issues that we have been shown today, I think it will be critical to figure out how can we resource the health sector so that innovation, research, and the ultimate results can be there, knowing that health also requires a lot of patience. Research also requires a lot of patience, and therefore it needs more dedication in the community that we can make so that there can be a sustained onslaught in ensuring that the health of the global citizens can be taken care of. So I'll end there just to say that I'm indeed overwhelmed, humbled, and I'm also very pleased to see that several Kenyans are also part of this wonderful team that is serving the world. Thank you.
And now to turn to the next chapter in the sustainability conversation. PEPFAR and the Ministry of Health have been committed to developing a sustainability roadmap in Kenya to plan the transition of support for the HIV program, moving from PEPFAR to the Ministry of Health. And so now I'm going to turn, hopefully, virtually, and welcome Ambassador Nakenga-san, who's going to be joining us to discuss the progress towards that sustainability and our shared commitments to the HIV sustainability roadmap. Hopefully. I see there's John. All right. Dr. Nakenga-san, over to you.
Thank you, Mandy. Excellency President Ruto, nation from Kenya, it is truly a great honor to join my colleagues at the US CDC to welcome you and to celebrate over the years. In my role as the US Global AIDS Coordinator, I'm truly privileged to speak on behalf of the years partnership that we've enjoyed with the government of Kenya and the people of Kenya in fighting HIV/AIDS. Excellent, the first time we would have been meeting, and I think your commitment from day one when we met in Washington during the leadership, you were kind enough to host us in your office. It speaks to truly your leadership in the fight against HIV/AIDS. And as Secretary Blinken stated, for us, Kenya is a key democratic partner, and we see increasingly countries working not only on the bilateral issues and opportunities that we have, but also to deal with regional and global threats. End of quote. One of the great global challenges of our time is the health development and security threat that HIV/AIDS continue to pose. We've achieved a long way to go to bring HIV/AIDS to an end as a public health threat by the year 2030. I'm also very pleased that over the last 21 years, we've invested over $7 billion in supporting your efforts to fight HIV/AIDS. And the results are very visible. Since 2003, the rates of new infections have decreased in Kenya by over 80%. Kenya is well on its way to achieving the 395 goals, and hopefully to bring HIV/AIDS to an end as a public health threat by 2030. Our collective responsibility now is to sustain the gains we've made, but accelerate the response so that we can close all the gaps in Kenya and celebrate this victory. And there are three priorities I'd like to share with you our reflections on. One is that to bridge inequity gaps that exist, especially amongst children, where we continue to see high rates of mother-to-child transmission of HIV in Kenya. Young people, especially adolescent girls and young women, need to be focused on going forward. And half of the population of Kenya is under the age of 18. And due to the process to fight against HIV, the generation has not seen the ugly face of HIV/AIDS, what all of us saw many, many years ago. And especially the youths, as the youths are saying, nothing for the youth without the youths. Key populations continue to be a priority population, especially men who have sex with men, and we have to work hand in hand to break down the barriers of stigma, discrimination that are potentially and have been proven to be an obstacle in the fight against HIV/AIDS in that population. Second priority is to support your government to increase its resources for the fight against HIV/AIDS both at home and regionally, and to do so through the sustainability framework that stated. We are very committed to applying our resources behind your leadership, behind your efforts, so that we can bring this fight against AIDS to an end. Thirdly and lastly is the manufacturing agenda, which my colleagues have highlighted, and I'm very pleased to see the shot a few minutes ago. The COVID-19 pandemic taught all of us that to ensure security of supply for critical medical commodities, Africa must take the lead in developing their manufacturing industry for health commodities. As the U.S.-Africa Leadership Summit in Washington in December, PEPFAR made a commitment to shift our HIV product procurement towards Africa-based manufacturing in support of that goal. And we heard already that we have committed to procuring up to 15 million tests if they were made in Africa. It's a unique opportunity for both the U.S. industries as well as the Kenyan industries to work together to realize that dream. So I'm very pleased to see what the Revital just presented a few minutes ago and look forward to their first HIV rapid test production. The pathway to ending HIV/AIDS as a public health threat and ensuring global health security will be incredibly. The United States government remains steadfast in our commitment to continue to work with you to ensure that this common goal and agenda is achieved. Thank you for the opportunity and really the honor of working with the people of Kenya and the government of Kenya in achieving these goals. Thank you.
Great, thank you, Ambassador Mganga-san. And before I turn it over to you, Your Excellency, I just want to remark on how thrilled we are to be signing the new Memorandum of Understanding between the CDC and KEMRI today. I think you know so many important discoveries have come from that partnership. Many WHO-recommended interventions have come from that CDC-supported Western Kenya platform, particularly in malaria, the fact that we recommend insecticide-treated nets that came from that work. The clinical trials that we now use to prevent HIV infection for the medicines for before and after exposure from that platform. And then the cost-effectiveness work we did around childhood vaccines for pneumonia and the rotavirus from that platform. So looking forward to signing this new Memorandum of Understanding, and it ensures we can continue that partnership well into the future. And in particular, I am excited that we are establishing the Kenya Applied Sciences Hub. I think this is going to be a hub that is a cross-agency effort without a specific disease focus, so it can be available to no matter what health threat comes our way in the future. And importantly, it's going to be a regional center for laboratory capacity building, biosafety and security, and diagnostic evaluation. I think you may know CDC has supported the establishment of Cell3 labs at KEMRI, and this will be the hub of that work. We're going to be working more on malaria, on genetic sequencing, and making sure we're working on, again, the next generation of the scientific advancement to power the manufacturing you were just hearing about. So thank you for that shared vision of collaboration as we work forward. And I now turn it over to you, Your Excellency, President of Kenya, William Ruto. Thank you.
Thank you very much. Please, let's take our seats. Thank you very much. Let me, at the outset, recognize Andrea Palm, Deputy Secretary of Human Service, Lois Page, Assistant Secretary for Global Affairs, and Dr. Cohen, Director of this great institution. Ladies and gentlemen, it's an honor for me to join you at this famous center. I am delighted to meet some of the greatest minds in health and celebrate a partnership that has stood the test of time, saved millions, and transformed the lives of many more in immense ways. The Kenya-US CDC collaboration showcases what is great and is a testament to the united goals and teamwork in driving change. This partnership have strengthened global health and guarded our communities. In 40 years, they have enhanced Kenya's health infrastructure, conducted research, and implemented interventions that saved numerous lives by curbing infectious diseases. President Biden has invited me to a state visit to the United States to honor and strengthen the deep friendship and shared goals of Kenya and the United States, rooted in our history of freedom and formalized at independence. This partnership has fostering democracy, security, and prosperity in Kenya and beyond. Kenya's history highlights the power of collaboration and solidarity, recognizing partnerships as transformative. We therefore hold our partners and allies in very high esteem. Our health system is supported by a diverse array of public, private, and non-governmental entities. Through the strategic partnerships with these sectors, including faith-based organizations, the government has expanded healthcare and enhanced capacity to tackle health challenges and emergencies efficiently. It is important to state directly and clearly that the U.S. government has been our greatest ally in this sector. Here is the headquarters of the organization, preeminent global authority on public health and a symbol of science working for the people everywhere in the world. When I saw the center up on second floor, I was amazed at what is happening here and the response you have from actors in different parts of the globe. CDC's ability to partner effectively with diverse agencies, coupled with Kenya's commitment to strategic collaborations, have enabled us to develop a high capacity to effectively respond to public health challenges and public health emergencies. Mindful of this capacity, Kenya is pursuing a bold bottom-up transformation agenda to drive inclusive growth, create jobs, create wealth. Central to this is the implementation of our universal health coverage plan. Partnerships, especially with the U.S., are crucial for our success. To underscore this, I have made it abundantly clear that every cent of technical, financial, or support from our partners must be managed, utilized, and accounted for efficiently. This requires a shared understanding and collaborative approach, including joint activities, unified planning, and budgeting towards agreed upon outcomes. I therefore encourage you to enhance support for better coordination, aligning efforts to improve our health. This includes prioritizing and investing in the implementation of the Kenya Health Sector Partnership and Coordination Framework. I discussed that particular aspect here. The President's Emergency Plan for AIDS Relief, PEPFAR, stands as a example of a fruitful partnership in combating HIV/AIDS for over 20 years, transforming despair into hope and prosperity. We've turned a once fatal disease into a manageable condition, achieving significant success in global health. Through collaboration, with the U.S., transitioning HIV, malaria, and tuberculosis programs into primary health care initiatives, aligning with this shift enhances program sustainability and meets the healthcare needs of vulnerable Kenyans country. The year 2020 marked the beginning of a dark era in health as the COVID-19 pandemic disrupted every aspect of our lives. Poor coordination, limited information sharing, and inadequate supply of commodities exposed glaring gaps in healthcare systems globally. Suddenly, readily available resources like oxygen became scarce and unaffordable for those in dire need. Recognizing then, as we do now, the imperative to strive for better, we aim to deliver sustainable health security for all our populations. Kenya is advancing towards health security. In 2022, we launched the National Public Health to enhance coordination and strengthen our public health systems in response to COVID-19 pandemic. This milestone signifies improving capacity for early detection, rapid response, accurate testing, and effective recovery management. The Institute marks a substantial step towards self-reliance, positioning Kenya as a vital contributor to global health security. I am encouraged by the robust spirit of collaboration, and we are grateful for the support of CDC in establishing the Kenya National Public Health Institute. We are looking forward to working together to develop policies and legal frameworks based on evidence for the Institute's success. Our collaboration with CDC extends beyond defending our own borders, securely enhancing regional and global health security through strengthened research, laboratories, surveillance systems, and emergency operations. Programs like field epidemiology and laboratory training and public health emergency managers have trained 800 professionals, and we aim to expand them to include more county and national health workers. I am reminded by the statement that was made that working with the county governments, we now have close to 100,000 community health promoters in Kenya to support this endeavor. To do this, we invite America's leading health training institutions such as Pelham Center of Advanced Medicine, Johns Hopkins, Harvard, Columbia, Duke, and Emory University in Atlanta to create exchange programs with Kenyan universities. Through such collaboration, we aim to expand learning horizons and deepen insights into emerging threats, including zoonotic diseases. Impact, innovation, and focus of the collaboration between Kenya and CDC has set a standard that transcends boundaries. Another organization which highlights the positive impact of effective partnership between Kenya and United States organizations is the Medical Research Institute. The partnership between CDC, the National Institute of Health, and KEMRI, spanning 7 research led to significant scientific discoveries, notably the malaria vaccine, enhancing healthcare outcomes. Increasing grants to KEMRI will help establish strong intellectual property and scientific entrepreneurship frameworks. This will support Kenya's focus on product development, a key component of our pharmaceutical and biomedical manufacturing sector, and our priorities. Further, regarding manufacturing, Kenya actively seeks due recognition as a stable, well-functioning and integrated regulatory system in the form of the World Health Organization's Maturity Level 3. Amendments to the Pharmaceutical and Poisons Board Act are in progress to support this goal, enhancing local pharmaceutical in both public and private sectors. In fact, come with the leadership of Parliament so that they understand the importance of changing the law, and they are here. And they have promised me that how many weeks I go back, how many weeks will the law be ready? In less than 2 weeks. In less than 2 weeks, I will have signed the law so that we can provide the legal framework for us to move our manufacturing to the next level. Amid interest from Asian and Middle East companies to invest in Africa, I warmly invite U.S. investors and manufacturers to explore opportunities in Kenya. Access to markets, including the East African community, a market of 300 million people, the common markets for Eastern and Central Africa, a market of 400 million people, and the Africa Continental Free Trade Area, a market that will expand to 1.4 billion people. Manufacturing, medical consumables, vaccines is a strategic investment. I commend USAID for supporting local investments like Revital and Dawa Limited through capacity building and matching funding. I want to... When I paid a visit to Revital in Kilifi, I was persuaded beyond any reasonable doubt that we have the requisite ability and capability to manufacture international products from Kenya. And made a commitment to local manufacturers that the first off-taker of their product was the Kenya government. I think local manufacturers, including Revital, today can confirm that we have changed course and they are our first port of call when we are looking for medical products. I have also made a policy decision that we are going to support local manufacturers, specifically Revital. We have already offered them extra land for them to expand their operation and meet the target they have told us here that they want to meet next year. And it is not just for them, it is for the other manufacturing facilities that we have in the country. In fact, we have designated one special economic zone in Thika to be the manufacturing hub for pharmaceutical products. We will be offering incentives for manufacture of pharmaceutical products for Kenya, for our region, and for the world. And looking at what Revital is doing, we are very confident that we can export to anywhere in the world. Proud to share the accomplishment of young innovators in Kenya, particularly in technological innovation, building on the success. Our visionaries in the Silicon Savannah are driving the digitization of health services, improving preventive health, and enhancing access to medical expertise through telemedicine. This health resources, including human capital, and enables remote medical reviews, enhancing accessibility. During the 28th Conference of Parties to the UN Framework Convention on Climate Change, I launched the Initiative to boost green industries across Africa, promoting climate action and economic growth. This integrates climate change with healthcare digitization, aiming to fully digitize public hospitals and transition them in the very near future. I am very happy $1 million to further this course. I also appreciate Power Africa, USAID Global Health Bureau, and their connect 10,000 health facilities in sub-Saharan Africa by 2027 are truly inspiring endeavor. We also welcome the Health, Electrification and Telecommunication Alliance to collaborate with the Ministry of County Governments to enhance these vital linkages for the benefit of millions. Ladies and gentlemen, our transformative partnership with CDC is a powerful example of the positive impact of shared values, commitment, and innovation on people's lives and future. In reinforcing the broader Kenya-US Partnership for Democracy, Security, and Prosperity, success is not magic, but the results of consistent application of our values in pursuit of collective goals. Through partnership, just in the landscape of public health, we are touching lives and changing the world. Thank you very much.
Your Excellency.
Thank you.
Yes. All right. So this event provides us the opportunity to celebrate and formalize the health partnership between the U.S. government, coming from the past through the present and into the future. So we're going to ceremonially acknowledge three specific, and we'll do the signing as we go here. So first, a proclamation that celebrates the 45-year partnership between Disease Control and Prevention and the government of Kenya, and it specifically highlights the future partnership between the Kenya National Institute and the CDC, which is obviously our National Public Health Institute. So Prime Cabinet Secretary Musalia Mudavade, did I get that? Did I do okay? And Darwin, get that one. We'll sign this proclamation. And I thought it's not unusual. Today we've heard about the impact of our collaboration to support ending HIV as a public health threat by 2030. Our joint focus is planning for the future of HIV programming to sustain quality and impact. Cabinet Secretary Susan Nakumia and Ambassador Meg Whitman of the United States Ambassador to Kenya will sign our joint commitment to developing an HIV sustainability roadmap by December 1st, 2024. So I get to work. Excellent. And finally, we're celebrating our partnership around research and implementation science through the signing of a memorandum of understanding between the U.S. Centers for Disease Control and Prevention and the Kenyan Medical Research Institute. The MOU will be signed by KEMRI Acting Director General Dr. Elijah Song and CDC Global Health Center Director Dr. Kayla Lasserson. All right, it's my honor to thank you again for joining us today. Your Excellency, thank you very much for stopping here to see us in Atlanta, and we will look forward to seeing many of you in D.C. over the next several days. Thank you for hosting us, and to the CDC family for all the hard work that it took to put this together. Thank you all, and have a good evening.